In this segment of the Medicare Made Simple story, we're reviewing Medicare Supplement plans, what they are and how they work, what they cover, what they cost, and when you can enroll. My name is John DeShaw, and I'm a financial advisor with Solera Asset Managers in Roseville, California, just outside Sacramento. I've completed the American Healthcare Insurance Professional certification year after year so that I can talk to people about traditional Medicare, Medicare Advantage, and Medicare Supplement plans. I'm licensed, contracted, and appointed with several of the major national and regional companies that offer those plans throughout the state of California and a few other states, so that I can offer my clients multiple choices when it comes to filling the gap of traditional Medicare. For compliance purposes, I must inform you this course is not affiliated with, nor is it endorsed by any government agency or the federal Medicare program. It's purely for educational purposes. Let's start with some Medicare basics. There are two main parts to original Medicare, Part A and Part B. Part A is your hospital coverage. It's free if you or your spouse have been working and paying taxes for 10 years. If not, you will pay a monthly premium to get it. Part B is your doctor or medical coverage. You will pay a monthly premium for Part B, which will change each year. Let's look at what Part A and Part B cost and what they don't pay for, so that you can understand why someone would even be interested in considering a Medicare supplement plan. You will need to be enrolled in Part A and B to be eligible to enroll in a Medicare supplement plan. Part A helps to pay for operating room and recovery room expenses, drugs, supplies, labs, x-rays used while you're in the hospital as an inpatient. Here are the basic costs for Part A. The premium is $0 for most people, as we discussed, but you will pay a deductible of $1,484 if you're admitted to the hospital. This covers you for the first 60 days in one benefit period. But if you stay longer than 60 days, you'll pay a $371 copay for each day. Then after day 90, you will pay $742 per day for 60 days. You are then responsible for 100% of the daily charges, whatever they come out to be. As it says at the bottom, Part A coverage and costs are based on benefit periods. A benefit period begins the day you're admitted to the hospital. It ends when you've been out for 60 days in a row. So if you have multiple events in the same year, you will have to pay the deductible and daily copay charges each time. Note in red, there is no annual out-of-pocket maximum on what you can be charged. Now that's the cost for Part A, very briefly. Now let's look at the second part, Part B, medical insurance. Part B helps pay for doctor services and outpatient care. Think of this as primarily helping with the cost of your medical care outside of the hospital. Like Part A, a strong feature is that you cannot be denied Part B coverage. Part B helps to pay for doctor visits, labs, blood tests, x-rays, physical therapy, other outpatient services. Regarding the cost for Part B, the 2021 premium is $148.50 a month for most people, but it may be more if your income 2 years earlier was above $88,000 for a single or above $176,000 for couples. You are required to have Part B if you are 65 and don't have health coverage through a current employer or a spouse's health plan. The 2021 annual deductible is $203. So after the deductible is met, you are responsible for 20% of the cost. Note in red, like in Part A, there is no annual out-of-pocket maximum, no limit to your financial risk. Well, that's a very quick look at original Medicare. So you would see why people for years have looked for a way to fill the gap of the federal government program. Step 2 is to decide if you need or you want additional coverage. It's available through private insurance companies. You have two options for filling the coverage. Option 1 in red is to add a Medicare supplement insurance plan and or a Part D prescription drug plan to original Medicare. Option 2 in blue is to choose a Medicare Advantage plan, what's known as Part C. The Medicare Advantage plans available in many areas include the Part D drug coverage as well as additional benefits. Now, these private plan options were created to give you more choices and the ability to fill in the gaps not covered by original Medicare. In this video, we are only looking at the first part of option 1, adding Medicare supplement insurance. You can watch our other videos on adding a Part D drug plan to original Medicare or considering option 2, a Medicare Advantage plan instead. So Medicare supplement insurance is offered by private insurance companies. As the name says, the plan supplements Medicare, so they're not Medicare plans. They are designed to fill in the gaps in original Medicare coverage, hence the name Medi-Gap. And they help to pay some or all of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. So do MedSups work? MedSups pay after Medicare first pays its share. Your healthcare provider gives you treatment and then bills Medicare. Medicare processes the bill, and if it approves the service, it pays what it's supposed to. It then sends the remainder of the charges to your MedSup plan to pay its share. Then any remainder, if there is any, is passed on to you. It's important to understand that Medicare decides if the claim is paid. If Medicare approves the bill, your MedSup plan must pay its share of your deductibles, co-pays, and coinsurance. We need to understand that Medicare supplement plans only cover what original Medicare covers. They most commonly do not cover anything in addition to that. So if Medicare doesn't cover the service, your MedSup plan doesn't cover it either. If you ever have a question about coverage, always check first with your plan, or you could be left holding the bag, and you don't want that. Here are some of the unique features of Medicare supplements. First, Medicare supplement plans allow you to see any provider that accepts Medicare. It doesn't matter if the doctor or hospital is contracted with the carrier. If they accept Medicare, they will also accept your MedSup plan. Second, all new Medicare beneficiaries are given a one-time 6-month open enrollment period to enroll in any Medicare supplement plan they choose that's offered in their area, with no health questions asked, no medical underwriting. If you apply during this window, your acceptance is guaranteed, so you want to pay attention to your enrollment period. Third, you do not need to choose a primary care provider with a MedSup plan. There are no referrals necessary in order to see a specialist. MedSups give you the most freedom of choice when it comes to receiving care. Fourth, MedSup plans are standardized by the federal government, making them easy to compare. Each is labeled with a letter. Every plan with the same letter offers the exact same benefits, no matter what state it's offered in, or no matter what insurance company offers it. Now, this chart shows all the standardized Medicare sub plans offered today listed across the top. The column on the left shows the benefits that regular Medicare does not pay for. In the center is the amount of that gap that a MedSup plan will pay. 100% means 100% of that expense is covered. As you can see, the level of coverage varies. There are standardized plans that cover all your Medicare deductibles, co-payments, and coinsurance, while there are others that leave some of those costs for you to pay for on your own. For example, if you're new to Medicare in 2021, the most comprehensive plan you could buy is a Plan G. Plan G from one insurance company has exactly the same benefits as Plan G from another insurance company. I know some of you are looking at this chart and saying, well, what about that Plan F that covers more than Plan G? Unfortunately, Plan F is no longer available. It's only available to individuals who turned 65 prior to January 1st of 2020. In general, MedSup plans have higher premiums than Medicare Advantage plans, but the costs on the back end are very predictable. For example, if you enroll in a Plan G, the only medical service expense you will have to pay for is your Part B annual deductible. So you will pay the first $203 of your care costs, but after that, all other costs are covered, other than the portion of a foreign travel emergency, which no plan fully covers. You will not have any copays, no out-of-pocket expenses other than your monthly MedSup premium, Part B, and Part D drug premiums and drug costs. So it's very easy to predict what your healthcare costs are going to be. Now, regarding costs or premiums, remember the benefits of each letter plan is standardized by Medicare. So a Plan G is a Plan G, no matter where you live or what insurance company is offering it. However, pricing is not standardized. So a company can charge whatever it wants to, and they do by region or state, and all plans are not offered in all areas. So it only makes sense to shop for a reasonably priced plan based on where you live. And here at Solera, we also take comparison for our clients even further than that. We not only look at the current price, we also look at a company's standardized rate increases. In other words, what is their history of how they raise premiums as you age? Yes, sadly, all Med Sup plans do increase rates year after year as you age, but that's not standardized how much they can increase it. Now, companies price their plans based on the cost of medical service where you live, so they can still be profitable. So costs vary. But to give you an idea, a Plan G currently for a 65-year-old newly Medicare eligible beneficiary can be anywhere from around $80 a month to $130 a month for the first year that you're new to Medicare. However, that varies quite a bit depending on where you live. But call us and we can give you a quote on what the range is based on where you live. Now, the best reasons clients choose a Medicare supplement plan are these. In our experience, Med Sup plans work very well for people who want the freedom to choose any provider they want. People who travel around the United States because they can see any provider they want to where they're traveling or visiting to, as long as that provider accepts Medicare. These plans also work well for people who just don't want the hassle of networks and having to go to get a referral just to see a specialist. They also work very well for individuals entering Medicare with a chronic health condition, which Medicare Advantage plans don't have a specific plan for. Or if you're a person who uses medical services often and you're worried about the cost you will encounter once you're on Medicare, then purchasing a Med Sup plan with a comprehensive coverage like Plan G will give you peace of mind, and you'll know that you will have very little out-of-pocket costs later on. In this case, your monthly premium really is your budget for healthcare costs. Now, one thing I want to mention here is that Medicare supplements do not include drug coverage. Neither does traditional Medicare A and B in most situations. And the reason is these plans were created before Medicare D even existed. However, it is easy to pick up an inexpensive Part D drug plan to go along with your original Medicare and your Med Sup plan. But we have another video all about that. But it is another card to carry and another insurance company to deal with when it comes to billing. So some people just simply see that as an inconvenience. Medicare Supplement has its own open enrollment period. During this period, you are not subject to medical underwriting. In other words, despite your health, your approval is guaranteed, but only for 6 months after you enroll in Part B at age 65 or older. You can still apply for a Med Sup plan after this time period, but you may be denied coverage or charged more based on your health history. You can check out our other videos to get more details on any of the subjects of Medicare. If you have questions or would like to schedule a virtual chat with us, here's our contact information. We're independent insurance brokers, specialists in Medicare. Our service to you is always 100% free of charge. We've helped many people like you through this difficult decision-making process, and we'd love to help you. Thank you for taking your time to watch this video with us.